Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the steps of phacoemulsification? So, right. In the steps of phacoemulsification, first, preparation should be done. In the preparation, we can give the patient either a retrobulbar anesthesia is given or a peribulbar anesthesia or a topical anesthesia can be given to the patient. And then one important thing is we will have to approach the cornea, so we have to do a limbal incision is given or clear corneal tunnel is created. So this is the cornea, so you give a limbal incision is given or a clear corneal tunnel is created. So this is mainly done by making a stab incision is made with the help of 2.75 to 3.2 keratome. With the help of 2.75 to 3.2 keratome, you have made an incision. And now you have entered the anterior chamber. Okay, this is the lens here. You have made an incision and you have entered into the anterior chamber. Now you inject the anterior chamber with a viscoelastic substance. Okay, you will enter the anterior chamber and inject the anterior chamber with viscoelastic substance. Now you will reach the lens. Okay, and then you will do a continuous capsulorhexis. A continuous capsulorhexis is done, and then trypan blue dye is used for this continuous capsulorhexis. Okay, once you have done a capsulorhexis, you will do a continuous capsulorhexis and you will do it with the help of trypan blue dye. Then now you will cleave the, if this is the lens, now you will cleavage between the cortex. This is the cortex, this is the nucleus, and you have a capsule here. Now you will cleave between the cortex and capsule, and then in between the cortex and capsule you will inject the water like substances or hydrodissection. Okay, you will inject some substance in between the cortex and the capsule, and you will separate the cortex and the capsule, similarly, which is called as hydrodissection. Similarly, you will separate the nucleus and the epinucleus also. That separation of nucleus and epinucleus is called as hydrodelineation. Okay, actually cleavage between the cortex and the capsule is called as hydrodissection. Then cleavage between the nucleus and the epinucleus which is present over it is called as hydrodelineation. So if you see, this is the hydrodissection, where we remove, this is the cortex, this gray color is cortex, this is the capsule. So we do cleavage, or we divide the cortex with the capsule. And then if you remove the nucleus with epinucleus, then that is hydrodelineation. So this is the nucleus. If you remove the nucleus with the epinucleus, then it is hydrodelumination. Now you do a phacoemulsification of the nucleus. In the phacoemulsification of the nucleus, actually we inject the phaco probe is put inside the nucleus, and this phaco probe will produce color, which will produce vibrations, which will vibrate and thus liquefying the substance of the lens. So through the phacoemulsification of the nucleus, there is liquefaction or liquefaction of the lens will occur. Now once the liquefied lens, it is easily aspirated with the help of cannula. So soft lens aspiration is done with the help of aspiration cannula. Then after aspirating the lens, we will have to implant the intraocular lens. In the intraocular lens, we will insert a soft foldable intraocular lens is inserted into the capsular bag. And finally we do an old wound closure. So these are the steps of phacoemulsification.
thank you and thank you for watching.